Hello, and welcome back to our presentation on clinical supervision, becoming a resilient leader. In part one, we actually went over all of our objectives and we actually made it over in our agenda down the list to our interactive activity with the vignettes. That's where we're going to pick up today. So I am going to move over to slide number 58. And we're going to get moving from there. This is part two of this presentation. So we're going to start with our first case study. And here's our first case study. Case study one. Heather's a 31-year-old new supervisee that was hired in an inpatient clinic that worked with alcohol use severe patients. She is working on her state licensure and plans on being under your supervision for the next 2 years. The outpatient clinic has agreed to pay for the weekly supervision sessions. Heather reported that she has never worked with substance use patients. However, she has been in treatment before. She reveals that she is in recovery and she has been sober for the past 10 years. In the past 10 years, Heather has been in school, yet she has very little work experience. She is extremely nice and refers to herself as a people person. Okay, so moving along, vignette one. The first week of Heather's supervision. So week one of supervision, Heather reports that she is fearful of many of her patients that have long criminal histories. She discloses that she had a dark past with nothing but nothing like her patient. She reported the patient have shared lots of information with her during the assessments and in groups. Heather's question for the session is, how do she work on becoming more comfortable with the patient? She shared that she really wants to be able to connect on a personal level without having to self-disclose. Heather also reported that the patients always ask if she is in recovery, but she is very uncomfortable with saying yes at this time. So how can this be approached with the supervisee? And should she disclose why or why not? So with vignette number one, how can this be approached with the supervisee? So one of the things that I typically like to talk to my supervisees about is just really being genuine and feeling that they can work with their clients, because their clients are getting to know them as well, and they're getting to know the clients and seeing what's going on. But with that, I always tend to let them know that being yourself and just working with your clients. Again, I do tell everyone when it comes down to disclosure with clients, I tell people to be very careful with that. However, I do say that some levels of disclosure, if it is a level of disclosure that's helping and not hurting, that is something that every clinician have to figure out for themselves. And so I would be very, very more at the point of telling Heather that, she would have to work into that comfortability on her own, but we can still work and talk about it every week throughout our sessions to help her feel more comfortable with it and helping her with the approach. Some approaches can look like doing icebreakers with the group when they come in and talking with them about different things. Sometimes I have seen where some of my supervisees that are in recovery have talked about their now smoking habit that they're trying to get rid of, or they've gotten rid of, or the fact that they have stopped smoking and now they're eating more and food tastes great and they never realized food tastes so great. So that could be a conversation around, going from one addiction to another. They go from being a person addicted to smoking, to a person kind of starting to be addicted to food and gaining more weight. So there are different things to talk about. And I've been in scenarios where individuals have talked about shopping too much or whatever the case may be. So those are different approaches and things that I do believe that Heather could think about and be able to work with some of her clients. But I think with the long criminal history part of it, again, talking with some of those individuals about and getting the understanding of what's kind of going on is also a part of what we do as far as getting to know our clients and building that rapport with them. So I would also encourage some of that as well, for her to get more comfortable with understanding who and what for each client. And hopefully that would help her to feel a little bit more comfortable with working with her clients. And also, I always tell all supervisees, excuse me, that comfortability comes with time. And comfortability comes with time. Every time you get a new group, a new set of patients, a new set of clients. But comfortability comes with time, that when even you get a new group or a new set of patients, that you already feel comfortable and you know your job and you are competent in what you're doing. So with Heather being very new at this, I will just really assure her that she will come around and continue to work with her, of course. Again, the self-disclosure part, why or why not? When she's comfortable enough, she'll know when it's time to self-disclose, when she is actually helping and not hurting, as well as not helping herself and really helping the patient. So those are my responses to the vignettes. And of course, when I do this supervision, we get a whole lot of different responses. And if you want to pause this and go ahead and see what type of responses that you get, if you're listening here with the group, that would be very, very, helpful as well. All right. So vignette number 2. Vignette number 2 is week 2 of supervision. In Heather's second session, she reported that she arrived in the treatment group this week to find that her ex-best friend's brother is in the treatment group. She reported that he was not aware of who she was, because she and his sister were really close friends over 10 years ago when they used drugs heavily. She reported her fear to disclose the information to her co-therapist or to her supervisor. Heather is asking, how should she approach the situation with her supervisor? What advice can be offered by the supervisor to the supervisee? So what advice can be offered? I'm sorry, to the supervisor. It should be to the supervisee. But the advice that can be offered is basically letting her supervisor know, and then her supervisor would kind of direct her with the co-therapist, knowing. But I do believe that definitely making sure that her supervisor is aware. And this is her supervisor on site. And so she's coming in for supervision, for state supervision with the individual like yourself or like me. And she's coming out of her agency where she works. So we are wanting to, of course, have that conversation with our supervisor, and our supervisor will direct her further with this conversation with her co-therapist, because a co-therapist will eventually have to know, I believe, just to make sure that they have a pretty good cohesive group and able to provide the services that they need to provide. And further from there, I would also encourage Heather to continue to work through her own insecurities with her being in recovery, because normally, I would say from my experience, this is just my experience again, a lot of times people that are in recovery tend to eventually get to the point where they're not necessarily sharing war stories, but they're really understanding once they get into the counseling profession, it starts to take a change and it starts to look different for them after they've been in the profession for quite some time, which for me, of course, not really having any addictions that, I kind of struggled with in the past that is relevant to substances or alcohol. I usually tell people that individuals that are coming to supervision that have had their, bouts with different things, they come in with a fear when they come in, and then after a while they kind of get really comfortable and they start to really know themselves and they start to really know, working with the patients and the clients they're working with. So things start to change over time. I would definitely offer that. And then I would definitely make sure that she makes certain, what it would be like if they have to be a family session with that individual's family and the sister might come in or something like that, that she would have to take herself out of that situation. And even if it gets to be, a little bit more in depth, there will be some other things that'll happen, of course. But normally when something like this comes up, just trying to make sure that everyone's on the same page, meaning Heather's on the same page with her co-therapist as well as her supervisor, and everyone's aware of the scenario and the situation. And the fact that he doesn't know who she is, then we kind of want to keep it that way. If the agency says that she has to continue on in those groups, but definitely working with her on a continuous basis about how she will be able to handle that situation if something comes up. But I would tell her to really make sure that everyone knows what's going on before it becomes a concern or a problem. So keeping it to herself is not going to be the best scenario. And again, with this vignette, if you want to pause this and then come up with some different things or whatever case can be, different interventions or different thoughts and ideas, that would be amazing. So we're going to move on to vignette 3, week 3 of supervision. In session this week, Heather shared that a patient asked her to attend his church for a graduation ceremony. She explained that it is a Greek Orthodox church. Heather asked if she should attend the event that her patient invited her to. She stated that she has always been interested in attending the Greek Orthodox church and reported it would be a multicultural experience. What advice should the supervisor give the supervisee? And are there any other issues around this to consider? So, well, first of all, as supervisees, supervisors, the counselor, we do not accept invitations from our patients. And a lot of our patients and clients sometimes don't know that. So one of the things that I always tell my supervisees is to make sure that your patients understand or the clients understand what is the relationship between you and them. And it's a therapist to client, client to therapist, counselor to client. It's where you're working with them in a professional manner. So in a professional manner, there are a lot of things that you cannot accept from them. They can't bring you flowers, they can't bring you little gifts, they can't do little things like that. That's something that we don't accept. That's a part of our code of ethics. That's one of the first things that I talk with supervisors about, to make sure they understand that. That's one of the videos that I put out earlier on in the year about understanding the code of ethics. But no, this would be something that I would really encourage Heather not to deal with. She can attend a Greek Orthodox church any given time she would like, but not this given time, because this is a client of hers. This is a patient that's under her care, and he is having a graduation ceremony at the church. But no, that's probably not going to be the best thing to do, because we typically don't, accept, invitations to any type of event for a patient or a client. If there's a graduation event at the facility where we're working, and I am working there, and it's my day at work. Most of the time, I've even seen where some people have come in on a day off because the class is graduating at the facility. For me, I'm one of those persons who's very kind of great, nice, or whatever. I may contribute to the whole office buying things or something like that, but I'm probably not going to show up on the day that they're actually graduating. If it's not my day to work, I probably won't be there. So, but that's just the way I work with things. Other supervisors and other supervisees may have some other comments on this. Things, like I said, issues to consider around all this stuff right here, other issues. Like I said, just maybe even crossing some boundaries. We definitely want to make sure that we stay up and up and we understand what boundary crossing might be, or even if we get into a point of a boundary violation, because asking someone to come somewhere and saying yes could be, things just get real. And I think that's really why it's in our code of ethics that we, kind of stay away from those things and really let our patients and our clients know our boundaries, off the gate. And we continue to reiterate that to them as they're in our programs. So, all right, I'm going to move right along to vignette 4. And vignette 4 is in week 4 of supervision. Heather arrives at your office late for supervision without warning. She reported that she needed an emergency session, but was unable to call to give you advance notice of the emergency. You are able to work her. You are able to work with her. However, you want to ensure she is aware of boundaries. Again, talking about what we just mentioned just now in vignette 3, just kind of making sure those boundaries are there. How do you address this issue with her superior? So basically, how do you address this as her superior? How are you going to address the situation with her? So again, I'm one of those persons, I don't want to come down on anyone. So we're going to talk about that. And the next one is, after you address the boundaries with her, you realize that Heather have major issues with boundaries in her professional life. How will you proceed with this conversation going forward? So this one right here comes up, and we're talking about the fact that, first, I'm her supervisor, I'm her superior. So I want to talk to her. I want to be very genuine with her. I want to be, very, I like to tell people, I like to try to be warm and understanding to what's going on. But I definitely want her to know that you can't just come in and think that it's going to be a free moment. Luckily, I have the time today. We'll do that. But I will just reiterate those boundaries. After addressing all that, then I would, talk to her about those major boundaries, in her professional life. I will kind of talk to her about it, and I will proceed with her to make sure we're having ongoing conversations going forward, and we will have ongoing conversations about it so we can have check-ins. Those check-ins will help to ensure that Heather's kind of getting a grip and kind of understanding what's going on and realizing how her professional life would have to kind of get to a more stable position when it comes down to boundaries. And that would be something that, like I said, we would talk about, and we would go over, kind of every session, and we'll jump back to it every now and then as well, just to make sure that she understands and she is actually getting the gist and the understanding of what's going on as she continues on in her career. So with that being said, with vignette 4, if you find that there's some other conversations that you can have around this, just go ahead and pause and have the conversation around what can be done, how her supervisor can actually speak with her and address everything, being the superior in the situation. And then also talking about how to address her with these boundaries that she may be having that's really affecting her professional life as well, these major boundary issues. All right, so I am going to move on to the next case study. All right, so case study number 2, you have been working with Supervisee Heather for about 1 year and 8 months. She has developed greatly over the period of supervision. She implemented skills regarding boundaries, confidentiality, having confidence, and understanding ethical and legal issues. She has also been able to handle several crises, well as as well as assess patients and implement treatment plans. Heather has become increasingly competent, and she is definitely able to vacillate between um, working vacillate between working, wanting to work more independently. So she's definitely able to move back and forth and get her stuff straight there. And then she's also wanting to reach out for help when she is not feeling um, most confident in her skills. So she's doing a great job with all that. It sounds like everything is moving forward. And then we have vignette number 5. Vignette number 5. Heather attended a supervision session where she is struggling with her career, and her great question is what to do, what do I do, and how do I do it in? Oh, excuse me. And how do I do it in? So basically, she states that she is feeling the pressure at work from other counseling peers and have started private work. Heather feels that she is ready. However, her confidence has been shaken due to all of the talk. All right. So, what are some suggestions for Heather? And as a supervisor, would you have concerns with Heather considering what to do and how to do it? Why or why not? So I would have issues with her having those concerns of, what to do and what not to do or how to do it. Because if you're going to try to, step out into private work, I always tell people you definitely want to be pretty much on point with what's going on in the current work that you're doing. The suggestions I would have for her is if she definitely made the if she made the step out, or is making the step out to private practice or private work, is it something that she feels good about? And if she doesn't feel good about it, I would talk to her about why she don't feel good about it. And if she feels good about it, I want to talk to her about why she feels good about it. But I want to make sure why or why not comes up in the conversation I'm having with her too, because the biggest thing is when you are looking to step out in private practice, a lot of times there's a lot of competencies that come along with being a great counselor and know what you're doing there. But there are other competencies that come along with, do you know how to run a business, and do you know how to, do some of the other administrative stuff that could really put anyone who is not confident and sure of themselves in a tailspin and could totally burn them out. Okay. So, and I say that from personal experience. So everyone's experience could be different. And even if it's not even private work, it's just going out and doing contractual work or whatever the case may be. All of that still comes with the whole tailspin of information and work and things like that. If having the one full-time job, if you're having some struggles there, or you're not feeling that competent, but you're feeling, pretty, stable there for the most part, it's just where she is. And that would be some of the things that I would be talking to her about, and some of the things I would be exploring with her over that time period. And yeah, I would definitely, yes, have concerns, because like I said, what to do and how to do it, those are things that, if you decide you want to jump out there and do something, you got to already have kind of an idea what you're going to do and what that looks like, and doing some research. So that's the other part, is that there's a ton of research out there that could help, direct the individual in how they're going to, do additional work, in that field, or if they're going to branch out into something else that's kind of still in the field, but maybe doing some trainings or something like that. You got to have some idea how that might look. You got to look at what scheduling is going to look like. So there are a lot of things that go along, not with just being competent in who you are as a counselor in the profession, but also as in how would you manage all those different things and being able to, manage your profession. So again, if you can want to pause this one just to talk about this vignette and come up with some other ideas, that would be a great moment right now to do so. Moving on to vignette six. Basically, in vignette six is talking about during the same supervision session, Heather reveals that she is feeling uncertain when working with some issues with clients in the past 2 weeks. She reported that she sometimes don't know what to do next in regards to their issues. So Heather stated that she sometimes struggle and have no idea what to say. She reported that she had one client that suffered with panic attacks and another who was diagnosed with borderline personality disorder. She reported that she felt clueless. How can you process this feeling with Heather, and why should you process this with the supervisee? So basically, I would be processing all these feelings with Heather. How to process it, I would be processing it with her. I would probably go from a cognitive behavior standpoint, just to use a theory with her and kind of really help her focus on, what's going on with her. And then I would also try to figure out where her competency level is when it comes to panic attacks and anxiety disorders and things of that nature, as well as borderline personality disorders. And I would tell her that, definitely being competent in those areas and knowing, when you take, when you're, and I understand this too, because when you're working in an agency, sometimes you're getting clients that are coming in with all kind of diagnoses. And the main issue there is because of addiction, but a lot of the other diagnoses are playing in the background that you're like, wait a minute now. So a lot of times that can cause some concerns. So I would be definitely talking about some of those things and working through some of those, and maybe some of those clients that are coming in with those underlining diagnoses and things of that nature. I would definitely be telling her to do your research, jump on it, make sure you kind of in the, understanding of what it takes to work with a borderline personality disorder person, which is a lot for most counselors. A lot of the counselors that specifically work with them are the DBT therapists, maybe even finding out more about some of the DBT techniques and things of that nature. Panic attack, same thing, working with individuals that are dealing with a lot of anxiety for the most part, finding out more in those areas as well. Again, looking at different types of therapies and different types of techniques that can be used and interventions. I would definitely process all that stuff with Heather. I would definitely, like I said, come from that cognitive behavior therapy approach. I would definitely make sure that me and her are touching bases. We are focusing on certain things. Probably even having check-ins to make sure, hey, did you make sure you talked about this? How did this work out? Things like that. Probably checking with her a little bit more often within the week before she sees me again. And then why should you process this information with the supervisee? It's because I want to make sure she is a competent, strong therapist, and make sure that she understands, that there are going to be different individuals that come in with all kinds of things that happen. Like I tell people, sometimes you may have a person that might come in for substance use addiction, and then you really find out that they have a sex addiction. So, there are a lot of different things. Not that you want to try to treat their sex addiction, but you kind of want to make sure that you are handling the reason why they actually came in there, and that you are able to make that referral for whatever else they need, but you're able to kind of work with them if you can through some of what's going on. Now, I do know in some scenarios, if a person comes in and they are schizophrenic and they are dealing with some substance use issues, love them to death. But if they're suicidal on top of that, we probably won't be able to keep them. If they're coming in for a residential stay, we have to send them to get cleared by the hospital or something like that to make sure. So, there's so many different areas here. Again, I want you to take a pause and kind of talk through this as well, talk through this vignette. Now would be a good time to do that as well. All right, now we're talking about vignette 7. In another session, Heather reported that a 17-year-old female client shared that she has a history of suicidal ideation and child abuse by her father that her mother is not aware of at the time. Heather stated that the client is 1 year from being 18, and she asked her not to tell her mother and not to confront her father about the abuse. This is a heavy one. Heather is concerned about the information, and she is also concerned about future discharge plans as the client is to go home with her parents after treatment. What are Heather's ethical and legal responsibilities? So evidently there's a lot of ethical and legal responsibilities there. The patient actually shared the information with her. So when a patient or a client shares that type of information, there is we are mandated that we have to report it. So because we're mandated, we have to report it to with DSS and all that stuff. We have to take that responsibility. Heather would definitely have to do that. Ethically, as far as talking with the parents, that would be something that would be addressed when DSS goes in. DSS will take it from there, and they're the ones who's doing the legal part of it, as in finding out, investigating it. We are not investigating anything of that nature. Typically, as counselors, we're putting the information down, we're documenting it, and we're passing it on to the appropriate, state mandated agencies to do what they do. Also, reminding individuals that you are a state mandated reporter if they are telling you about suicide, or if they're telling you about wanting to hurt themselves, or wanting to hurt someone else, or if they tell you that they've been abused in some type of way, whether it be an adult or a child. We have to, by law, we have to, and ethics, we have to report it. So that is something I always tend to tell people when they come in for sessions, that is the relationship. And that's, again, going back into those boundaries as well. So at this time, you can take a break. I'm sorry, you can take a break and discuss a little bit more of vignette number 7. Then we're going to move on to vignette number 8. Last month of supervision, Heather's attendance has been great. However, you noticed her level of engagement appears to be low. You have discussed self-care with her over the past 2 years, but in this session, you notice that Heather's lack of excitement for completing this process, and she appears to have less of a desire to become fully licensed. You must address this because Heather mentions she may not want to continue to practice after she receives her full licensure. So, how should you approach this with Heather? What can you suggest to help Heather regain her motivation? And are there any additional supports that you can offer as it relates to continuing support, guidance, and encouragement as she moves from supervisee to colleague? So one of the biggest thing here is really considering and having a good conversation with her, as far as just approaching her and letting her know what you've noticed and what you are feeling from what's going on with her, and be supportive and be, of course, guide, continue to guide her for the most part. But I would say always suggest self-care, taking a break, even if she wants to become fully licensed and then take a break for a little bit, take a month or 2 off just to kind of regain, refocus, rejuvenate. Sometimes that's a big part of getting back into the swing of things. And then also looking at the considerations when it comes down to, making sure that as she's going through her career, that she is taking care of herself and she's taking care of all the things that she have to take care of. Just maybe even coming up with a little plan with her, since, she'll be moving into being a colleague soon, from supervisee to colleague. Maybe having a plan with her, just being able to check in and work with her and make sure that she, remains okay. And even if she decides to stay in the field, leave the field, be supportive no matter what. Guide her and help her as much as you can. I've seen individuals who have stayed in the field and put their license kind of on freeze, where they didn't use it for the first year or two until they figured out what they wanted to do. They kept renewing, they kept doing their hours and things like that, but they weren't really fully engaged. I've experienced that. And then I've experienced people that have left the field altogether, and some that just refused to come back because they'd gone into a whole different line of work that's just a little bit more rewarding for them. So there are just so many ways that this conversation can be had, and so many things that could be looked at in the scenario. But I do like this particular case study in this vignette because it does help us kind of clarify some things. So at this time, you can definitely take a minute to go ahead and talk about some differences or some different things that could have been done in vignette number 8. But with that being said, we are now going to go ahead and bring this part of part 2 to a close, and we will be picking up with part 3 and finishing off the remainder of this particular presentation. So clinical supervision with the resilience, being a resilient therapist, being a resilient counselor, being a resilient supervisor. We're going to finish this off with part 3. And when we get into part 3, we're going to be looking at ethics and legal dimensions of clinical supervision. And we will go from there. And I think the last part of it, we'll be looking at self-care and some other areas as well. So thank you so much. And I hope you enjoyed the part 2 of this presentation. Have a great one.